Okay, so I'm just going to give you a brief introduction to how to use the advanced organizers on a day-to-day basis when you're on the ward. So basically, the goal of these tools is to be able to bring it up on your phone or print it out if you prefer, and follow along with the algorithm as you write it out so the student can see your thought process and the approach to management while you teach it. So I have it on my iPad here today just so that you guys can actually see it because my phone is really tiny to be recorded on, but you can bring it up on your phone beside you and just use it as a reference. The ideal time for this is to be used in an informal setting when you have a few moments of downtime on the ward, but it can be used anytime if you have free time before or after a good teaching case, or you're about to send a student down to see a gynae consult and you want to review an approach before you go send them. And keep in mind you can follow it in as much or as little detail as you like. The second page, which I will show you in a second, each advanced organizer is 2 pages. The second page is to support your knowledge and allow you to provide more in-depth teaching and feel confident about the information that you're providing, knowing that it's accurate. So there are 11 advanced organizers in total. There are 6 obstetrical and 5 gynae. And basically, let's just pick some things. So let's say somebody's presenting to triage with spotting. You go through your list, you pick antepartum hemorrhage, and you can see this is 2 pages. So the first page is the, I picked AUB. The first page is your approach, your algorithm that you're going to walk through with the patient, and the second page is your supporting information. You'll also see on the algorithm that there are places that are marked with orange labels that say P1 or P2, and you'll see in some places there are red labels. Those are prompts for you to ask the student questions as you go through, and the prompts are on the second page with the answers below. And then there are also red labels on some of the advanced organizers that are teaching points. We'll go through that in a second. So very quickly, I won't belabor this. You can take as much time or as little time as you want with the student, but basically let's say you have a lady in triage who's G2, T1, L1, and she's, 36 weeks, and she's coming in with vaginal bleeding, and you want to walk through an approach to this with your student. So first things first, you're going to assess stability, and then review your differential. So this has a little prompt beside it. This is right here. Review your differential. So you're going to scroll down to the next page and you're going to ask, the student what's their approach to a differential for vaginal bleeding in pregnancy. And then it's all here. And then, you want to make sure you know where the placenta is, and take a good history. And then you move on to your physical. At any time while you're taking your history, if she's unstable, or the fetal heart rate is abnormal, you're gonna immediately recess, call for help, and prepare to deliver. But if you have time, you're gonna go through your vitals, your fetal heart rate, your TOCO, your Leopold's, and then you're gonna grab your resident for the remainder of the exam, and you're gonna do a pelvic exam. And then you can walk through all of the components of a pelvic exam. So, you're looking for other sources of bleeding. If there's no previa, you can do a speculum exam to visualize the vagina and the cervix and consider a digital exam to assess for dilation. And if there's a previa, you want to consider the role of your speculum exam. And then you get into kind of your diagnosis and your approach to management. So if you know they're bleeding, what investigations are you going to do? So your APH labs, you can talk through that with your student. And if there's no bleeding, you can reassure and consider your disposition. Okay, and then at the bottom of the page, there's a general approach to management. So most important thing, RH-neg, well, one of the important things, they're gonna get Winrow. And then there's a little bit of a blurb on whether they're stable in preterm or stable in term or unstable. And then on your second page, there's some definitions, there's some prompts for teaching, and then on every advanced organizer, there's a key points square that you want to go over and make sure always be reassessing maternal fetal stability, approach to differentials, you're painless or painful, always knowing where the placenta is and confirming RH status. So that's a quick approach to one of the obstetrical cases. Let's say you have a consult in the emerge, you have a gynae downstairs, and you're going to send a med student to see them. So let's say it's an adnexal mass. So on the gynae AOs, you have, a lot of them have approach to differential first and then approach to assessment. And then of course, the second page is all of your supporting information. So, you know, with any gynae differential approach, I always start, is it gynae or non-gynae? And I won't walk through this entire thing with you guys because you can see it, it's written right there, but basically you walk through the algorithm for your approach to your differential, which is all here. And then you can also walk through with the student their approach to the assessment. So approach to the history, the physical exam, investigations, and there are prompts here. So you can review with the student, what are the components of a gynae history? What are the components of a malignancy review of systems before you send them down? And then after, when they come up to review, you can talk through, you know, what are the tumor markers, what are the risk factors for ovarian cancer, and then there's some teaching points on types of ovarian cancers and a general approach to management for the differential. So that's basically how they work. You can familiarize yourself with them. You can use them as much or as little as you like. You don't have to use them at all. And please reach out to me at any time if you have any questions. Or if you find any errors that need to be updated. Thank you so much for considering participating in our project.